The main mission at Yale-New Transplant Center is to provide outstanding clinical care to our patients with cutting-edge science, pushing the boundaries of cutting-edge science not only in how we do transplants and how transplants can remain successful, but how we can do it better with fewer complications, with less side effects, and with longer lasting results.
I believe what makes Yale-New Transplant Center unique is the fact that we have both great clinical delivery of care and we also have some amazing basic scientists. And to be able to combine the two, to offer cutting-edge, innovative research, is really what sets us apart.
Our special areas of expertise are in heart, liver, kidney, and pancreas transplants for both adults and children. We have one of the top living donor liver transplant programs in the country. We have a wonderful array of immunologists that give us a huge advantage in trying to optimize the way we treat our patients. That makes us really unique.
We built this living donor liver transplant program around the philosophy of everything twirls around the donor safety. We have a unique living donor advocate team. It's living donor coordinator, living donor second advocate is social worker, as well as we have psychologists. They walk with donor, talk with donor, live through the whole process with the donor. The donors, they're admitted to intensive care units for 2 nights after the operation. That will give us the best possible care and monitoring for our living donors. We have a unique approach to the pain management. Our living donors, they receive Reiki massage therapies and day before surgery and towards the end of their admission. We've proven that we were able to decrease their pain and somewhere around 50%.
Our pediatric transplant program is focused on our patients and their families. It's a multidisciplinary approach to the patient. We have transplant surgeons, we have pediatric surgeons, we have transplant hepatologists, transplant nephrologists, all specialized in kids. We have a fantastic group of social workers, coordinators, and child life specialists. So our goal is to provide the best to our kids that are very sick with all these different members of the team.
In terms of research, the focus is repair, regeneration, and replacement, because one of the key issues in transplant was looking at the number of organs that are available for transplantation right now and the number of organs that potentially could be used but are rejected because they're not to the highest quality. To try to design new methods that we could regenerate those organs that normally would not be used for transplant, repair them, and then finally put them in as replacement organs, therefore increasing the pool of organs that are available for transplantation.
I think we're really looking towards even greater collaboration between our clinicians and our basic scientists. I mean, we're very fortunate that we have a vigorous multi-organ clinical transplant program. And we also have some of the world's best immunobiologists, hepatologists, nephrologists doing cutting-edge research.
In my laboratory, a lot of the focus is on the understanding of how the immune system damages the vasculature of a transplanted organ. We're very interested in understanding how it is that the immune system affects those 2 sets of vessels.
Telemedicine is a very popular and growing field, and it's very important. What we can do is taking useful daily devices like your phone, like an iPad, a personal computer, and taking those devices and using them in ways that we can incorporate secure webcam technology together with electronic medical record sharing and use these dualities as a format to help monitor patients.
Anyone that's working in the medical center, first and foremost, is in to improve patient care, make the life of the patient better, improve the ability of them to survive a procedure, and all of that's related to this whole idea of getting the best possible organs to them.
If we can impact the safety of donors and innovate to provide donors with a better experience, I think that's what sets us apart.
Our program has been getting better and better. We've been climbing up at the national level.
The stimulating academic environment, the expertise that we have here, both in biomedical sciences and immunology and in the basic sciences, and all the opportunities we have here to take clinical transplant program and to amp it up to the next level so that we can take the best possible care of our patients.